to the U.S. Department of Education. And as I said, we are entering our 30th year. And we do primarily serve so-called adult Vermonters, but with also having talent search and a Gear Up program as part of VSAC, along with a couple of upward bound programs currently operating at Northern Vermont University, Johnson and Linden campuses, and Castleton University. We occasionally will work with high school seniors who are not served by those other programs. And so that allows us to also work with that younger population at times. There are 7 counselors throughout the state. And so, you know, prior to the middle of March, all of our meetings were in person, primarily one-on-one with the counselor in that area. But since then, we've been meeting virtually with people using phone meetings or Zoom meetings, and have made that transition quite successfully, meeting both our target numbers for the 2019-20 academic year and our percentage of 2/3 first generation and low income participants, exceeding both, in fact.
Good.
Okay. All right, so we have 3 panelists with us this morning as part of this presentation. And I will introduce them individually as each of their parts begins. And they are, just up front, Amy Stuart from CCV, Shawn McElwain from Vermont Technical College, and Rebecca, who goes by Becky Kapsalis from the UVM Health Network. So we're going to begin with the Community College of Vermont. And one thing I just wanted to also promote to start with is that, you know, health careers in many instances provide a career ladder, and probably the most easy to illustrate is the career ladder represented by nursing. So it's not uncommon for me to meet with someone who is currently a personal care attendant who wishes to become an LNA, and who may do that through a tech center program, or sometimes a program offered by a facility that is training individuals at no cost in some instances, though they often require a work commitment to become a licensed nursing assistant. Licensed nursing assistants will sometimes branch off into to becoming a phlebotomist, to becoming a medical assistant, sometimes with additional training, well, always with additional training required, but, and others will go on to nursing. And so today we'll learn about practical nursing programs, registered nursing programs, and the role of the Community College of Vermont in helping people access those programs. And also, you know, beyond that, I have students who are moving from their associate degree in nursing to their bachelor degree in nursing. Some nurses will maybe go into nurse education, so they may get a master's degree in education. Other nurses may become nurse practitioners, so that's also an advanced area. So that's just an example of a career ladder, and probably the easiest one to illustrate. So we're going to begin with Community College of Vermont and Amy Stuart, who is representing CCV today. Amy is a coordinator of student advising. She's been with the college for more than 20 years. And a statement that Amy provided is, says that acknowledging students' capacity to gather information, think things through, and make decisions. Amy coaches students in meeting their short and long-term academic and career goals. Thank you, Amy.
Terrific. It's great to be here with Shawn and Becky and Monica and our tech support, Chris. I also want to acknowledge a colleague of mine, Tripate Mubai, is in the audience. He's also a coordinator of student advising. And I'm really happy folks who showed up today. Zoom is a really new experience, relatively new experience for me, although it's been months now, so I guess I don't get to say that much longer. But I'm hoping everyone will just take a couple of long breaths with me. Just breathe in as deeply as you can and breathe out. And one last time, breathing in and breathing out. Thank you. Oxygen to the brain is probably one of the most significant things we can do when we're thinking about career and college and training, and certainly about health careers. I very much appreciate that CCV affords students many ways to begin thinking about careers through coursework and certificates. And most of what I'm going to share with you today are certificate programs that you can reach within a year. And those certificate programs could all help you work on an associate degree. They could help you get the job you want. They may propel you into new educational opportunities. And they certainly will be an asset on an application, especially if you're changing careers from something you've done for a little while to something brand new. Or if you have rusty or skills you'd like to build to communicate more effectively, think a little more clearly, and write a little more convincingly. So I have a slide here that shares with you the kinds of careers you can seek with some education, with a lot of education, and maybe there's no requirement for education, but it certainly would be useful in your pathway. Administrative or clinical medical assistants, pharmacy techs, nurses, medical and billing coders, community health workers, and lab technicians are all the jobs that some of CCV students who follow these career paths secure upon graduation. Chris, next slide, please. What I'm going to show you next, and what's missing is the definition for, or the title slides for each of these, but that's okay. I think I could figure them out. The first certificate is medical billing and coding. And the medical billing and coding career is basically about 10 courses. They include some gen ed coursework in writing, thinking, reasoning, and speaking, as well as some work in specific courses related to medical billing and coding. Human biology, which gives an overview of all the systems, MedTerm, and medical billing and coding 1 and 2. Certification in medical billing and coding is sometimes a state, sometimes a national certification. And those rules are usually available on the Vermont Secretary of State website. For medical billing and coders, they ask you to complete basic life support, especially since some folks who are working toward this degree move on to other options. All right, next slide. I also want to share that this information is also available on the public website. This is where I gathered all of these details. So for 30 or 35 credits, that's about 10 or 11 courses, you can work toward a certificate in clinical medical assisting. And you'll see some of the coursework is similar: human biology, a computer or tech class, English comp and intro to healthcare, all give students an opportunity to consider the bigger picture that you're a part of. After working toward developing skills in writing and thinking and reasoning, you move on to some of the clinical medical assisting opportunities. And the next one. Thanks, Chris. Yep. This particular certificate is in allied health preparation. I call this certificate a shell. It's a frame. It doesn't get you any job. What it allows you to do is use financial aid to complete coursework that may be prerequisite work or co-requisite work for college programs in things like dental hygiene or nursing or radiography. So it's a shell, and frankly, some students use this for graduate school too. If you want to become a physical therapist or move on for a master's degree in a similar field that you were trained for, but it's been a long time since you've had some of this coursework. So some graduate schools require students to repeat some of it. And the courses involved in this traditionally for nursing, since that's often the audience we're speaking with, people who want to be nurses, is A&P 1 and 2, Human Anatomy, Physiology 1 and 2, Nutrition and Human Growth and Development, are all courses that help strengthen your application to nursing school. Doing very well in all those classes is, I think, paramount to demonstrating your readiness and eagerness to be a member of a nursing class, especially at Vermont Technical College. All right, next slide, please. We have about 3 more. The next certificate, ooh, that looks like medical billing and coding again. But maybe, oh no, it isn't. You know what it is? I think this certificate is administrative medical assisting. And on to the next slide. This is the pharmacy tech certificate. And again, all of these certificates you can finish in 8 to 11 courses. So going to school full-time or even part-time for a year, you can have this coursework accomplished, accenting your resume or preparing your application for further education in other fields. All right, Chris, next one. Yeah, and this particular one without a title is the associate degree. An associate degree is full-time, about 2 years of college coursework. It will take most students who are attending full-time 2 years, but many of our students at CCV, over 80% of them are attending school part-time. So if you were to go part-time, it could take you 3 years, maybe 4, depending on how quickly you want to move through the coursework. And every single certificate that I've already spoken about fits, it snugly fits inside this associate degree. So you could actually work toward a certificate, and let's say you're waitlisted for nursing school and you want to work on some more coursework or open up the doors to other careers. You could take all of that nursing prep work and put it inside an associate degree in health science. The specific options for this course, again, are on the website, too many to list here. I do want to add that anybody who applies to and attends CCV is welcome at CCV. We have 24-hour virtual tutoring available to help students who struggle in certain areas like math or English. We also have those services available to people who are just overwhelmed with some of the content in things like microbiology or accounting. Anatomy and Physiology 1, to be specific to health careers. Additionally, every single student who attends CCV has an academic advisor. And while some students might not need support or guidance, many students do. And it helps to brainstorm the questions that you have, the decisions that you're trying to make, and the kinds of strategies that'll serve you best as a student attending CCV. And lastly, just want to make it clear, during this time of COVID, most of our courses have online components. In fact, all of them do this semester, all of them did this summer. We are providing more and more synchronous online learning opportunities that involve students connecting to Zoom on a weekly basis for a couple of hours. And we do provide a very small number of courses that have 2 to 4 or maybe 5 in-class meetings. Social distancing and other precautions are required in order to participate in those quote unquote hybrid model formats for course delivery. There's a lot of support for learning what it means to be an online learner. You can access that through the Center for Online Learning, a bunch of web pages on our website, as well as training in the learning management system we use when students are taking online courses. For CCV, that learning management system is called Canvas. I'll take any questions at the end, but I know we have not a ton of time, and there's a few other people who are going to share. Chris, thanks for your help with the slideshow.
Of course.
I think
If
we're
I
on
may,
Shawn.
If I may, real quick, we did have one question I'm hoping we can circle back to real quick regarding
Sure.
CCV's tutoring.
Yes.
Do you all offer tutoring via tutor.com, or is there another program or platform that you utilize?
Yeah, thanks so much for asking. We actually use tutor.com. So students can chat with a tutor, schedule a phone appointment with a tutor, a Zoom appointment with a tutor, or submit things that they would like a tutor to look at and give feedback on before they complete a second or third draft for submission to their teachers. When we're in the buildings, some of our academic centers have learning centers where peer mentors or peer academic mentors can support students in things like organizing their work for the week or deciphering or breaking apart an assignment.
Thank
Amy,
you for
I have
addressing
a
that
question.
question.
I actually have a question, Amy, before I forget it, if it's okay. So I'm just thinking about these programs, thinking about how people could earn, credits, perhaps if they are on a wait list, or a lot of kids take gap years now. And I imagine,
Yes.
COVID times, I actually have a daughter that's preparing to complete her college applications and getting them in next month. And I know there's just a lot of uncertainty with young people now. If a student takes a gap year and wants to take courses at CCV, and they know, for instance, that they want to go into pre-med or that they want to go into nursing, how do we make sure that those credits are going to be transferable? So let's use the nursing school at UVM for an example. If somebody wanted to take a gap year but wanted to take some classes at CCV working towards their nursing degree, is there assurance that those are reciprocal, that they're going to transfer to another school?
I hear your question, and let me just summarize it, Becky.
Yeah.
I hear that for some students, they're taking gap years, or they might want to start some college before they actually go to the institution where they'll secure their bachelor degrees.
Yeah.
And you're curious about whether or not our courses transfer to another college and university.
Yeah.
CCV is fully accredited by the same institution that accredits UVM, Middlebury, St. Mike's, and Vermont Technical College. And we are often supporting students who are transferring to other colleges in the state and beyond the state, including UVM. UVM enjoys our students. They can't wait to get their hands on them. And we have many, many transfer agreements with colleges in the state. Each college at UVM, there's 6 of them, have their own ideas about how our courses will help students reach the goals that they have for the degrees they're seeking in each of those colleges. UVM generously provides a transfer guide for any student to use. It's publicly available on their website. So when I meet with students who want to go to nursing school, we look at that transfer guide. And if there's any questions regarding how a course transfers, like A&P 1 and 2, we would call the college and speak with one of the staff members at that college to determine if at this time they're accepting these credits.
Okay.
They go through an evaluation every few years at UVM, as they do at every institution. CCV does the same to determine what courses from other colleges and institutions are meeting the standards that they have for similar or same courses at their institution.
That's great. Thank you, Amy. You answered that perfectly.
Sure. Any other questions, Chris?
Nope, no other questions have come through.
Terrific. Thanks, everybody.
Thanks, Amy. All right, next we're going to hear from Vermont Technical College and Shawn McElwain. And I just remembered too that when I was identifying other programs that serve first generation and low income seniors in Vermont, I didn't mention UVM Upward Bound. So that's one other one that's helping students in our area here where I live in Chittenden County. So Shawn is representing Vermont Technical College, where he's Assistant Director of Admissions and also Transfer Coordinator. Shawn has been with VTC for 5 years and also worked in admissions and helped transfer students at Champlain for 8 years prior to that. And prior to that, he was in a higher education related position at SUNY Plattsburgh. So welcome, Shawn, and let's hear about Vermont Tech.
Sure. Thanks for having us. So I'm pinch hitting for Susan Fredette, who was hoping to be here today, but had something come up. And so Susan is our primary point of contact in the admissions office for all things nursing. The rest of us kind of help out with everything else, but because of the transfer piece and so many of our nursing students having done previous credits, especially through our partners at CCV, I work with a lot of the nursing students as well. So hopefully I'll be able to give you the same information she would have. Our slide that we have up here, it shows all of the programs that we have available to students that want to go into a nursing or health professions field. We have our Bachelor's of Science in Dental Hygiene. What we don't broadcast very often, and it's not on our website often either, is that we also offer an associate's degree in dental hygiene. It's a 3-year program. At the end of that 3rd year, the students sit for their licensure exam and can go into the field and work as a dental hygienist. The last year of the program to get to the full BS is completely online and it's optional. 90 to 95% of our students typically do the full 4-year program. But there is the option, and we do have a handful of students from time to time that will drop out, or not drop out, but leave the program after year 3 with their licensure and may or may not finish that last year at some point down the road. The Dental Hygiene Degree Completion Program, that's an online degree completion program for students that have finished an associate's in dental hygiene from one of our partner institutions around the country. So right now we currently have, I believe there's 12 to 15 partners that we work with. And then we're adding new ones. In fact, I was just working on earlier today with our director of the dental hygiene program on a new program partnership out in the middle of the country. It's a very small school. It'll be interesting to see how that goes. Their courses don't quite match up with ours, but we're trying to work out ways to get the students to be able to do both programs and make it work. Our most common and popular program is our nursing program. And like Monica mentioned earlier, our program is a lot different than some of the other nursing programs around the state and the country. We actually work in a career stepladder model. And so students come into the program first in our certificate of practical nursing or our LPN program year. Then they can move into what's our 2nd year, our nursing associate's degree, and get their RN license. And then at the end of that, they can move into the degree completion for the BSN part, which is completely online. The certificate program is 1 year. It's about 10 months straight through. There's not much of a break. So students will do a typical fall, spring, and then a second spring and summer term. At the end of that 10 months, they'll sit for their licensing exam to get their LPN license and then move directly into the associates if they want to, or they can step away from the program and work in the field as an LPN. If they decide to continue in the program, we do have what's called a direct progression, which allows students that have maintained a B average overall in their nursing coursework in that first year and have passed the NCLEX for their LPN license to be able to stay in their seat and not have to reapply for the associate's degree year, so that it allows the students to have no interruptions in pursuing that associate's degree. The 2nd year of the program for the RN track year is 2 semesters. It's a fall and spring term. At the end of that spring term, they would sit for their NCLEX for their RN license. And again, they can step away from the program at that point and work in the field as an RN, or they can continue on to do the BSN full-time online in 2 years, or have up to 6 years to do it part-time. So we developed that completion portion of the degree specifically in the mindset of we wanted students to be able to get their credential, get out in the field and work, but also be working towards completing and finishing that BSN if needed. The industry is changing a bit too, and so there's a little bit more emphasis on having the full BSN. And so we wanted to keep the options available for students in that area. We also have a certificate program for paramedicine. for students that have already received their EMT license and want to become a certified professional EMT. So the paramedicine certificate program is a year and a half. It's a fall and spring semester. And class time, we typically only have students on campus 1 day a week. It's full days on Thursdays right now. And it allows students to be able to do everything else on their own time and still be able to maintain and work. And then that second fall semester, they do their ride along and do their professional kind of internship or clinical experience ride along program. And at the end of that, they can sit for the exam and be done with the program. We also have a 2-year program in radiological sciences or X-ray tech. And then we also have our associate's degree in respiratory therapy. Like Amy had mentioned, we do have a lot of our students transferring into these programs, especially from nursing and respiratory therapy and RadSci from CCV. Dental hygiene tends to come from, our transfers tend to come from more across the country, especially New England. But the majority of the students that we see coming in from working at CCV, we typically see them doing the Allied Health Prep Certificate program that Amy mentioned. That tends to be the one that helps them knock out a lot of credit ahead of time. Our programs are pretty intense and do require a full-time commitment for the most part, but having some of those non-nursing courses done ahead of time while they're going through the application process will make them a stronger applicant for the program, but also will allow them to kind of have a little bit lighter course load as they're going through the program, be able to still maybe work 10 to 20 hours a week as well as go to school. So we really definitely encourage and support students that are looking at that process. And then I work with the folks across the state at the different CCV locations to make sure that students that are doing that route are taking courses that are going to be relevant, that if there's choice and options in their certificates, that they're taking the ones that are the most relevant to the program they want to go into, so that we can kind of maximize their time and effort and finances while they're getting ready to go into the program. All of our health profession programs typically have a December 1st deadline for priority review. Majority of them will fill seats after that initial review. And then after December 1st, we start going to a rolling application process at that point. Are there any questions that folks have?
Nothing has come through the chat as of yet.
All right. And then is there a way for me to, Chris, to share my screen for a minute or?
Yep.
So I know one of the questions that had come up previously when Amy was talking was, is there a way for students to know that what they're taking is going to count for programs that they're doing? And one of the things that we have worked really hard on over this past this past summer is going live with a new software piece. So we are partnering with College Source and using their test software. And so this is the public landing page that comes from our transfer webpage on our site. But students can come here and look for their school. And so if they scroll down to Community College of Vermont, this will give them a course-by-course equivalency for everything that's been approved to count on our campus. So, you know, if they're taking managerial accounting, it's going to count for managerial accounting on our end. So this goes through, there's 2 pages full of courses right now. We're still working on adding more of them as we go. But this is a great resource for students to take a look at. A lot of schools, even schools like NVU, Castleton, UVM, they are also on here as well. If they have a public page, then they would also have equivalencies listed for students to be able to see. So these are a great resource for students to be able to check and look for themselves if they don't want to reach out to somebody in the office. However, you know, that's why we're here too. So I'm happy to help answer those questions and kind of help walk students through equivalencies as well. But again, just a great resource for folks on the counseling side of things, but also for students to be able to access on their own as well.
So one question I often get is, and I didn't happen to scan the list to spot it, but community college, all programs offer a course called Dimensions of Self and Society. And will that fulfill the an Arts and Humanities elective?
Yes. Yep. So the Dimensions courses always come in to satisfy an art and humanity elective for a student.
Mm-hmm. And the other thing, Shawn, yesterday, Danielle Calloway attended our biweekly EOC staff meeting. She's a project manager for outreach and recruitment at VTC, and she talked about specific to health careers, some of the Ed2Go programs. And I just mentioned to her that you were going to be joining us for the health careers Zoom room today. And but I will just put in a plug. I do have some students currently who are doing, the ones that I think of are who are doing fully online medical billing and coding program through Ed2Go, and they're using advancement grants to finance that through VSAC. And there are a number of health career online programs that people might be interested in just a different format.
Yes, and Maureen from our office, for our continuing ed and workforce development office, sent a thing through the chat too. So this is the link that she was referring to here. So we do have some professional trainings and certificates offered through that department as well. We have trainings for LNA, phlebotomy, and then some of those online certificate programs like you were mentioning as well, in medical billing and coding, dental assistant, medical interpreter as well. So, and those programs have different start terms and start dates and application processes than the traditional admissions route. But the contact information for Maureen and her team are on here, and these are also wonderful programs. The other one that we also have on our campus as well is we also have an LPN certification process as well that's done through an online portal on our website too.
Great. Okay, thank you. Any questions?
Any other questions at all, or?
Nothing else has come through the chat as far as questions. Amy did add a little plug in there as well, just to confirm that the Vermont State Colleges share a course numbering system and database. So all CCV classes will transfer to VTC. And she mentions that the guide will help students understand how. Yep.
Yeah, and the only part that we haven't been able to get the whole VSC on board with yet, in terms of the course numbering system, is math. For some reason, we just can't get everybody on the same page with the math course numbers. So that can sometimes be a little bit wonky, but again, we work with the students and with the advisors across the VSC to help kind of understand which math is appropriate and which ones are not.
Okay, so we're going to move on to our third panelist, Rebecca Kapsalis. Becky has been a human resource professional in Vermont for more than 20 years, working for organizations like Country Home Products, Magic Hat, and the Howard Center. And for the last 10 years, Becky has led talent acquisition for the UVM Medical Center, now the UVM Health Network. So welcome, Becky.
Thank you for having me, and hello, Tui Pate. Tui Pate and I work together at the Howard Center, so it's good to see you.
Hi, how are you, Becky?
Good. And a huge shout out and thank you to VTC and CCV for helping to prepare Vermonters for the workforce, and specifically working for the UVM Health Network and UVM Medical Center. So a few things that I just want to point out as follow-ups to some of what Shawn and Amy have shared. So first of all, the LPN, the program that is LPN to nursing, Oftentimes in the past, we've been able to get out in front of some VTC students to let them know that we have a lot of LPN openings here at the hospital that are really difficult for us to fill. So what we're finding is that more and more nursing professionals are choosing to continue on to get their associates and their bachelors, which is great. We also need nurses. But what is happening is we just don't have very many people that are LPNs. So I think I just want to make a pitch that that is a really viable option for folks, that we do always have a need for LPNs here, and we are always struggling with how best to fill those needs. I'll also say that at UVM Medical Center at the Health Network, we do require a bachelor's. So that's not to say that we don't on occasion hire RNs with, and I mean a bachelor's for nursing. So it doesn't mean that on occasion we don't hire RNs with associates. We do, but we require that they be enrolled in a program to move towards getting their bachelor's within a year. So so that is important for me to point out. Every day of the week, we have many openings for LNAs. So thrilled to know that there is support for training and certifying and licensing nursing professionals as LNAs. I will say that at the hospital, we offer a number of ways that we train and educate people from the community within our organization. So the LNA trainee program is one of those. So twice a year, we run a program for LNA trainees where we hire in a cohort of people and educate them to become LNAs. At the completion of their education, they take the exam to be licensed, and at that point, they are offered a job. So that's guaranteed if they pass. We pay for that education, and what we ask is that there is a commitment to maintaining employment with us on the unit that they're being hired into for at least a year. We also offer training internally, or actually in collaboration with right now, Vermont High Tech, for phlebotomists. And that's another program that we are running a couple of times a year, are hiring in cohort groups of, I think this last one was around 12 people. And they go through a trainee program through Vermont High Tech. They receive a stipend during their education or their training. And then they also are offered a position at the completion of their program. Another trainee program that we are actually working hard to get off the ground, but we have not brought it across the finish line yet, is the pharmacy tech training. So we are just about to sign an agreement with an external training provider that will be able to offer online training to employees to become certified pharmacy techs. We're hoping to roll that out within the next few months. So these are all positions that are all multi-incumbent. We always have a need for them. Again, thrilled to know that VTC and VCC offer education for folks, but we also offer education for them here. We also offer, once somebody becomes an RN with our organization, there are a few internal internship programs that we provide training to become specialized in a certain area. So the peri-op or the OR trainee program is one of them. The critical care internship is another, and the emergency department internship is another one of those. I think that covers it for our internal training programs. I will also mention that once somebody is an employee here and after they have worked for us for 6 months, they do, as long as they are a part-time or full-time employee, so not temporary and not per diem, they are eligible for tuition assistance. So once you start working with us, that is a good way to get some assistance with furthering education. And we have lots of great examples of that internally. So I think I want to spend most of my time just really kind of walking you through the website. And unfortunately, I was not able to share my screen. So Chris is graciously sharing his and will act as a potential job seeker as I sort of walk you through our career page. So when you go to the uvmmedicalcenter.org internet site, you will see that along the top, you have some options, and careers is listed there as one of them. So you would click on careers. And once you're in there, you have a number of choices you can make to sort of better educate yourself. So before we actually go searching for a job, I do just want to point out to you that along the bottom, you'll see that there's a tab called Hiring Process, a tab for Working Here, a tab for current employees, and then a tab for jobs in healthcare. So if you want to explore the site a little bit more, learn a little bit more about our hiring process, for instance, or working at the organization, I encourage you to go there. If you are a job seeker and you know what you're coming to the site for, and you're looking for a specific job, you have the opportunity to go ahead and type in some keywords. And so, Chris, for the sake of this conversation, as an opportunity for me to get out and advertise to folks our need for pharmacy techs right now, if you would click into that box, enter job title, just enter pharmacy and see what comes up. Chris, are you able to hear me?
Oh, yes, sorry, resume. There we go.
Okay. So Chris just typed in the keyword pharmacy, and you will see that right off the bat, it pulls up, 6 opportunities for pharmacy techs. Those are what we have available now, but I will say, as is true for many departments within the UVM Medical Center, we are transforming ourselves into network functions, and that is true of pharmacy as well. So within the coming year or so, we are likely to have a bit of an explosion of pharmacy tech need, which is part of the reason why we're getting this training program off the ground internally. But as an example, that's how you search on our site, just simply typing in keywords. Chris, if you would go back and go ahead and just write nurse in that box, see what that pulls up. So on every day of the week, we are likely to have at least 150 nurse positions open. Thankfully, a lot of these we are able to fill with new grads. So we have a wonderful situation where not only are we well connected with graduates of VTC, but also of Castleton and of UVM. And so thankfully, many new grads are very eager to get a job with us. And so many of those we can fill, but many of them we cannot fill with new grads. And so, like I said, as I shared, oftentimes a new grad will need to get a foot in the door, say in a general medicine unit, and then need to participate in an internship, for instance, to become more specialized and be able to work in some of these other areas. We also always have positions on the inpatient side, which means you're working, in the hospital with patients day to day that are staying overnight. And then we have plenty that are also on the outpatient site, meaning working in our clinics. And most of those positions are Monday through Friday during office hour days. Some of them do require some weekend days. And now we're offering that for primary care, for instance. And those are more, oftentimes are more triage type nurse positions. You'll see that we have LNA posting here. That is pretty much a given all the time, looking for LNAs. If I had a voice that would be heard by all educators in the area, my plea would be, let's do more LNA training and recruit more people into doing that. It is a great stepping stone. And to use us as an example at the Health Network, once you have your foot in the door as an LNA and you have the ability to tap into tuition assistance, then there's the potential of moving on to becoming an LPN and then an RN, which is a great career. And so anyway, so anyone I get the chance to sort of preach that to, I will. Medical assistants are other positions that we often have. The medical assistant is almost similar to an LNA, but it's on the outpatient side. So it's working in those clinics. We do not require a certification for medical assistants, but with that being said, if I am looking at candidates that have that certification, they would be a more suitable candidate for me to move through for those opportunities than others. I'll also say that there is a position that is a step above a medical assistant that's called clinical care associate. And those positions do require a higher level of training and education. And again, would be another reason why somebody might want to make sure that they have a medical assistant certification. So I'll stop talking. Hopefully there are some questions for me, whether it's from the panel or from the rest of the group.
We did have one question come through, Becky, regarding salary. Are you able to share a little bit with everybody maybe what LNAs start at for salary?
I would have to, I don't know off the top of my head. What I will say is we just increased our wage floor. So no positions at our organization pay any less than $15 an hour. At this point, if I can navigate while staying on Zoom to my ATS, get a more exact number for you. It will take me a few minutes though.
So I wanted to mention too, and because I'm aware of this because I have a student involved in it this semester, that CCV has a pharmacy tech apprenticeship currently. And so as I said, I have a student who started that this fall. It includes just 3 classes: Intro to Pharmacy, Spreadsheets, and the Customer Service course. And I believe it's been developed in conjunction with CVS, is that right? CVS pharmacies. And so people will, upon completion of those courses, or maybe somewhere in the midst of that, will have an internship or apprenticeship experience at one of those pharmacies. So that's another example of the pipeline, I suppose. And also I have a woman who's this semester in her first semester at community college who became a dental assistant through the Center for Technology in Essex. She works in a pediatric dental practice in South Burlington, and she's beginning coursework at CCV with intentions of applying to the dental hygiene program at Vermont Tech. So that dental assisting opportunity exists with a great transition through CCB to dental hygiene.
That's great. I do have an answer to the starting wage for an LNA. So somebody who is just, has no experience under their belt would be starting as an LNA with us at $15.31 an hour. A lot of what we offer, though, along with base compensation, is a very generous benefits package, which I think oftentimes is a great motivator for people wanting to work at the hospital. So including generous number of days off and health and welfare benefits.
Yeah, that's really an important consideration for people.
Yeah.
And I from students or former students who reported to me, sometimes those benefits don't exist at the many LNA positions at care facilities.
Mm-hmm.
So that would really separate the UVM Health Network in terms of offering benefits to those individuals trained as licensed nursing assistants.
Yes.
So any other questions coming through, Chris?
No formal questions. We did have a note in here from Maureen, actually, that Vermont Tech has developed an LPN apprenticeship with CVMC, BMH, and VDOL. Wasn't sure if there was any further, insight or information we wanted to share on that topic.
So my colleague, Robert Patterson at CVMC, I know was really involved in getting that program together. I don't know the specifics of it. I wouldn't be able to speak to it. I'd have to look to you, Shawn, I guess.
Yeah, I'm not familiar with that program apprenticeship. Maureen might be able to unmute though to give us some info.
Hi, this is Maureen Hebert from Vermont Technical College Continuing Education. We were able to develop an approved apprenticeship program. It's a registered apprenticeship program through the Vermont Department of Labor. It's in conjunction with CVMC and Brattleboro Memorial Hospital. We're hoping to expand that program to other facilities. We have a similar program at Littleton Hospital right now in New Hampshire. The goal is to expand apprenticeship opportunities in general, be they for healthcare or other industry sectors. So more to come on that. It really is an organizational driven program. So if there are other facilities that are interested in exploring this, it allows students the ability to earn and learn. And it's a more flexible format so participants can continue working.
So Maureen, I can speak on behalf of the UVM Health Network, again, just sharing that we're going to, we're moving towards a shared service for the UVM Health Network. And so in our future, which is not too distant, we will be recruiting for and creating a pipeline for RNs across all affiliates. So there definitely is a desire to expand that program that Robert was so involved in for CVMC for the network. And in fact, I have a meeting with him scheduled this week to talk a little bit more about it. So news to follow.
No other questions have come through. Unless there's any other final thoughts, I wonder if Monica, you want to close us out? Oh, you're muted.
Okay, thanks. So as I mentioned up front, these Zoom rooms, as we've called them, have been operating since late July. And these are the next topics coming up in the coming weeks. Next week, there's again a panel with loan staff from VSAC, and I'll be conducting that along with Stacy King, my colleague in the EOC program. The following week, we'll be looking at educational resources for former refugees, immigrants, and asylees. And I'll be joined by panelists from USCRI Vermont, what was formerly known as the Refugee Resettlement Program, from Vermont Adult Learning, and from and again from Community College of Vermont. And we have 2 former refugees who are currently interns with our program, and they will be speaking about their educational experience as part of that Zoom room. And then I think 2 weeks after that, there's a food insecurity session. Many students struggle with food insecurity as full-time college students, and that probably has even been exacerbated by the pandemic, is my guess. So we're going to address that topic in 3 weeks. So, or maybe it's 4, because I know we've got one that we're opening to the TRIO community on Election Day on November 3rd. So this is a map of Vermont, and as I mentioned, there's 7 counselors that do this work. We're overseen by our project director, Mary Lynn Tatarchikoff, who keeps us all, who's our supervisor, and does a lot of outreach to help us build our network of referrals and affiliations around the state. And so this is the toll-free number that people can call to schedule an appointment. All our services are free. We've even this year gone to an online application for services. We do have to have that documentation as a federally funded program. And so that's been working very well, particularly since prior to that, we filled out paper applications in our in-person meetings, and that ceased to be very practical, and we were having to mail stuff and or mail these applications, have them come back to the counselors that go to VSAC. So with our online application now, that's become quite streamlined. So we're very appreciative of that. And I want to again thank Becky and Shawn and Amy for joining our Zoom room today. I think it was great content, and again, these are available for viewing after today's session. They're pre-recorded, so anyone who might be interested, you could refer a student or an employee to check it out. And I think there was a lot of good information here today. So thanks very much, and thanks, Chris, for assisting us all in making this happen. And have a great day, everybody.
Thank you. Thank you for inviting me.